Listening comprehension. This test consists of 3 tasks. You will hear each of the recordings twice. Task 1. You will hear some extracts of different radio programs. For each extract, 1 to 5, choose the heading that best matches the information you have heard. Write the corresponding letter in the white boxes provided and on the separate answer sheet. There are 3 headings you will not need. Extract 0 has been matched to heading G as an example. Now you have 1 minute to read headings A to I.
It's that time of year, you know, the sneezing, runny nose, fever, and headache time of year. That's right, flu season. And like most illnesses, it's better to try and prevent it than to try to treat it once you're sick.
There really is nothing that works quite as well as getting a flu shot.
Dr. Janice Blair, an infectious disease specialist at Mayo Clinic, says a shot doesn't guarantee you won't get the flu, but if you do, symptoms are...
Number 1.
It's true. After you donate blood at the American Red Cross, you get cookies and juice. And it just may be the most satisfying snack you've ever had. That's because patients in 23 hospitals across Northwest Ohio and Southeast Michigan depend on generous people like you to give the life-saving blood products they need. And when you do, we promise, you'll feel good.
Number 2.
People in the south of England are healthier and likely to live longer than their counterparts in the north. That's according to a new government study released today. Men in northern counties die on average 2 years earlier than their southern equivalents. That's partly due to higher levels of obesity and smoking-related disease. Manchester has one of the highest rates of premature deaths through smoking. The views of some smokers and drinkers in Manchester. The government figures also reveal the UK has the highest obesity rate in Europe. Carol Sikora is Professor of Cancer Medicine at Hammersmith Hospital. He says poorer diet is contributing to the problem.
It all comes to education. It comes to education in schools and also education by primary care nurses in general practice, by the receptionists in general practice. Every healthcare encounter for a mother with a child is an opportunity for education, and it's not used. We live in a target-driven culture which drives us all crazy.
Number 3.
If you enjoy exercising in the great outdoors, you should know the answer to this question. When does your body need more water? When working out in the winter or in the summer? Actually, it's a trick question. Your body needs just as much water in the winter as it does in the summer. Begin drinking water about 2 hours before any type of exercise and continue throughout your workout. A reminder from Medical Mutual.
Number 4.
Health workers from across the UK have been marching on Parliament in a show of opposition to the government's handling of the NHS. Campaigners travelled to Westminster to demonstrate over NHS cuts and privatisation. Doctors, nurses, midwives, cleaners and other support staff were among the marchers. Michael Wilkes is the chairman of the British Medical Association. He says one flaw in the government's strategy is to focus on offering patients more choice.
People who are ill do not necessarily want to make choice and won't have the information to make viable choices. What they want is a good local NHS that provides their health care locally. One of the examples in the competition area is that the government is saying, well, healthcare can be like a supermarket. You know, we'll drive prices down and we'll drive quality up. You don't buy healthcare like you buy apples or pears.
Number 5.
Every year, thousands of patients have their wisdom teeth removed. But if so many need to be removed, have you ever wondered why we have them?
The purpose thousands of years ago was you needed them because you lost other teeth.
Dr. Chris Viazzi is an oral and maxillofacial surgeon at Mayo Clinic. He says that as our diet evolved to include softer, highly processed foods, life for our teeth became easier. We don't lose them like we used to, but that's the problem. Our wisdom teeth are still there, and often there's not enough space to accommodate them.
Whether they're completely impacted or partially erupted, they can cause problems. And those problems can range from annoying problems to very serious ones.
If you do need your wisdom teeth removed, it's better to do so when you're young, typically between the ages of 15 and 25. The difficulty of surgery and the rate of complications increase in older patients.